I often sit back and I have all of my nursing career and thought, how would I like to be treated?
My name is Robyn.
My name's Therese.
My name is Aisha.
I'm a registered nurse and I've been nursing for over 40 years.
I'm a registered nurse as well, and I've been working in aged care for 33 years.
I've been a nurse for almost 20 years now.
What sets your team apart?
Because we're the A-team.
Teamwork.
Teamwork, definitely. You've got to have, and we've got that teamwork happening, so yeah.
And we've got a wide range of experience between us, but in your whole organisation really.
40, 30, 20, that's a lot of years.
We make ourselves aware of what's happening, not just with our own clients, but with clients of other nurses as well.
So that if one of us is not here on a certain day, we do have a history of the clients, and we can also offer advice in the office to NDIS clients. If the NDIS coordinator's got a question about, continence products, or how do I go about this, what should I do about this, we can advise them.
I think the most important thing is making everybody feel comfortable. So not only the client, but the family, if there's family there as well, so you can establish a rapport. And I think that that's the most important thing, so that they're happy to share information with me and we can find out really what their needs are and what's important to them. I also like to quietly have a look around at their home environment and see if there's any obvious risks or areas of concern. But I think the most important thing is just developing that rapport and having having a good conversation, making them feel comfortable. Definitely encourage it. It's good to hear their take on things. It gives you a much clearer picture all round.
So we look at medical conditions, physical abilities, diagnosis, medications. We also talk to the GPs as well and get a patient history from them and any concerns that they've got. We also look at functional abilities, so their mobility, their walking, their strength, any weaknesses that they may have. We can also do continence assessments and also cognition assessments within our clinical assessment as well. And we do liaise with the GPs quite heavily as well, and family members. It's yearly for the clinical assessment and then on a request for the other ones as well. Can take anywhere from an hour to 2 hours, just depending on the complexities of the customers. And also often we find that when we do go out there and we've built up that rapport, they want to keep talking. They like to tell us what's been happening with them in their lives and with their medical conditions. So we get the sort of the whole holistic approach, don't we?
Yep.
Even their ability to shower themselves, so that we can offer supports that will assist them to stay at home for as long as possible. Because that's where they want to be.
Yeah, sure.
And that's where we want them to be as well, because it's the best place for them. We can also do continence assessments and also cognition assessments within our clinical assessment as well. It's normally pre-requested, yes. If a customer's got a little bit of memory loss or a diagnosis of dementia or Alzheimer's disease, we'll often do a clinical assessment with the cognitive assessment. And we can also apply to the government to get a supplement for that adds a bit more money into the customer's package so that they've got more funds to support them to stay at home. So yeah, and the continence assessments, if people are needing, say, continence aids like pads or catheters or Kylie's on the bed and things like that, we can go out and we can assess what would be the most suitable for them, and we can arrange sample packs and then they can trial them and let us know what is best suited to them, and then we can advise the team what they need to order. We sit where the care circles are, so we get to hear the conversations that are going on, and we can pipe up and say, look, maybe they need this, or maybe we need to go and do an assessment for a level 2 client because they're struggling, we need to be able to get ACAT out to get a higher package for them, so that we can then get the money that they require to get the services in to help them. Yeah.
We also like to see the care circles notify us if a customer has been in hospital and they've returned home. It's always recommended that we contact them, and it may require a visit as well, just to see if anything has changed or if their needs have increased and that we're meeting all their clinical needs.
Because we do recognise that their abilities do actually change when they're in hospital because they get deconditioned. So we've then got to get them back up to and provide supports to get them back up to that level that they're safe in their own home.
Number one is client safety. So I get to know their medical conditions and how it affects them in their day-to-day lives, and also how it affects their families, service providers. And it also, as a nurse, it dictates our clinical relationship with the patient, basically. So every assessment is different. So if we assess the client from a year ago or 2 years ago, they may be different. The clinical assessment provides updated information. We get to know the client fairly well. And not just the clients, but their families, their backgrounds, and how they're coping at home, what their needs are. The clinical assessment is tailor-made for the client.